Bonjour, bonjour. Hi, everyone. Just to introduce our guests today, we have Foreign Minister François-Philippe, Health Minister Patty Hajdu, Chief Public Health Officer Dr. Tam, and Dr. New, Deputy Public Health Officer. They have some statements, and then we'll take some questions. So, go ahead.
Merci. Bonne journée à tous. Je tenais à faire d'abord une mise à jour concernant l'évacuation des citoyens canadiens de Wuhan. Comme beaucoup d'entre vous le savent déjà sans doute, le premier avion canadien a atterri ce matin à Wuhan après un court vol en provenance de Hanoï. L'avion est actuellement stationné à l'aéroport de Wuhan où les Canadiens passent par des contrôles et embarquent présentement sur le vol. Notre évacuation est donc en cours. Nous attendons le départ à tout instant de l'avion canadien. Il devrait arriver à la base des forces canadiennes de Trenton aux petites heures du matin, le 7 février. Comme prévu, nous avons eu quelques absences à l'aéroport ce matin, la plupart liées à des changements d'avis de dernière minute. L'avion américain, quant à lui, qui va évacuer un nombre additionnel de Canadiens et de Canadiennes, est également sur place à Wuhan. Comme je l'ai dit hier, ce vol partira juste après le nôtre et devrait également atterrir à Vancouver aux petites heures du matin, le 7 février. Les passagers canadiens débarqueront pour ensuite monter à bord d'un avion en direction de Trenton. Nous confirmerons au public lorsque ces deux vols auront commencé leur voyage vers le Canada. Nous confirmerons également aux Canadiens et aux Canadiennes le nombre définitif de ressortissants canadiens à bord de ces deux appareils à ce moment-là. Ce que je peux vous dire d'ores et déjà, c'est qu'entre ces deux vols, environ 2/3 des Canadiens cherchant à être évacués de Wuhan seront partis vers le Canada. Bien entendu, cela signifie qu'un deuxième vol canadien sera nécessaire. Le départ de ce vol est actuellement prévu de Wuhan le 10 février pour un atterrissage au Canada le 11 février. Et il s'agit véritablement d'une mobilisation du gouvernement en entier. Et bien que nous n'en sommes pas encore arrivés à la fin, je voudrais reconnaître le travail exemplaire des fonctionnaires qui ont monté une opération complexe dans le but d'aider les Canadiens. Avant de conclure, j'aimerais rappeler une fois de plus aux Canadiens qui nous écoutent que nous déconseillons tous les voyages dans la province de Hubei et tous les voyages non essentiels en Chine dans son ensemble. Nous conseillons également aux Canadiens et aux Canadiennes dont la présence en Chine n'est pas essentielle d'envisager de partir par des moyens commerciaux. So good day, everyone. I wanted to provide you this morning with an update regarding the evacuation of Canadian citizens from Wuhan. As many of you are no doubt aware, the first Canadian charter flight landed this morning in Wuhan after a short flight from Hanoi. It is currently stationed in the Wuhan airport where passengers are being screened and boarding the flight as we speak. Our evacuation is therefore underway. We expect the Canadian plane to depart momentarily, and it is scheduled to arrive at CFB Trenton in the early hours of the 7th of February. As expected, we had a small numbers of no-shows at the airport, mostly related to individuals who changed their minds at the last minute. The American plane, which will evacuate an additional number of Canadians, is also currently on the ground in Wuhan. As I said yesterday, that flight will leave shortly after our plane and is also expected to land in Trenton in the early hours of the 7th of February. We will confirm publicly once both of these flights have begun their journeys to Canada. We will also confirm the final numbers of Canadians on board at that point. What I can already tell you is that between these two flights, approximately 2/3 of the Canadians seeking to be evacuated from Wuhan would have left for Canada. Of course, that means that a second Canadian charter will be necessary. That plane is currently scheduled to depart Wuhan on the 10th of February and to land back in Canada on the 11th of February. That was truly a whole-of-government effort, and while we are not there yet, I would like to recognize the hard work of the incredible public servants who made this complex operation happen to help Canadians in need. Before closing, I would like once again to remind Canadians, those who are watching us now, that we're advising against all travel to Hubei province and against all non-essential travel to China as a whole. We are also advising Canadians whose presence in China is not essential to consider leaving via commercial means. Thank you. Minister.
Well, thank you very much, Minister Champagne. And as you've heard, we're taking careful measures to minimize the risks to Canadians here at home, but also to protect the health of Canadians who are returning. So I'm going to give you an overview of the steps we're taking to ensure a safe repatriation process at CFB Trenton. Chinese health authorities are screening travelers before they get to the airport, and anyone who is ill will not be allowed to board the flight. D&D medical staff will also assess passengers, taking the temperature of each traveler and checking for symptoms of the coronavirus. In addition, D&D staff are also assessing the medical status of each traveler to determine if they're fit to fly. On board the flight, D&D medical staff will perform health assessments of each person, and travelers will complete a health declaration and receive and sign a passenger information and acknowledgement form. Any passenger who falls ill on the plane will be isolated on the plane. The flight will stop in Vancouver for refueling, and before landing, the flight crew will alert officials if any passengers on the plane are showing signs of illness. And if a passenger requires urgent care, protocols are in place to transfer them safely to a medical facility. Before landing, the flight crew will notify CFB Trenton if any passengers on the plane are showing symptoms of the illness. And upon arrival, a CBSA officer and quarantine officer will board the plane and talk to DND medical staff to ensure no one has been ill during the flight. If an illness is suspected, the patient will be transferred to a hospital for medical assistance. Travelers who are not ill will deplane to undergo CBSA processing. Once the travelers are processed, quarantine officers will verify and collect the health declaration and acknowledgement forms. And they may ask additional questions if they suspect potential high-risk exposure in some travelers. These travelers could be asked for more information about their health and situations. Travelers will then proceed to the hangar, where they will be given an information package and assigned a room. Each traveler will have a room, and families will be grouped together. All bedrooms have complete bathrooms with a shower. Emergency management assistance teams from the province of Ontario will provide on-site primary care, including social services, and each traveler will also receive a daily health assessment. The National Microbiology Mobile Lab will be on site to test any symptomatic travelers. And there will be general help provided to all travelers that includes clothing, diapers, food, formula, and games. Once the 14-day quarantine period ends, travelers will be able to return to their homes. For those travelers coming from China by commercial flights and not part of repatriation efforts, screening continues upon arrival. And we continue to work with our partners across the country to detect, contain, and prevent the spread of the coronavirus in Canada. It is a critical time in the global efforts to contain and limit the outbreak and to prevent further global spread. The research and data on this virus continues to evolve, and we'll continue to adapt our advice for travelers based on the latest science. Travelers coming via commercial flights who have been in Hubei province continue to be at an increased risk of having contracted the virus. If you have traveled to Hubei province in the last 14 days, limit your contact with others from the date that you left Hubei. This means self-isolate and stay at home. The coronavirus can cause a range of mild to severe symptoms. It is possible that people will not know when they first develop symptoms because they can be very similar to a cold or a flu. Our airport screening advice is being updated to reflect this recommendation. For travelers coming from the rest of China, we recommend that they self-monitor for symptoms and report to local health authorities should they be concerned about the novel coronavirus or if they are feeling unwell. As the global situation evolves, we will adjust continuously our response based on the latest knowledge and evidence. Canada's disease prevention and control systems are working well, and the risk of an outbreak of the coronavirus here in Canada remains low. I want to thank all of the officials at all levels of government for working so closely together. The health and safety of all Canadians is our top priority. Thank you.
Dr. Tam, do you have any statement? No? Good? Okay. We're going to start with Fanny Olivier from Radio-Canada.
Bonjour, M. Champagne. Peut-être une mise à jour sur les Canadiens qui sont coincés sur le bateau de croisière. Est-ce qu'il y aurait...
Lequel?
Celui au Japon.
Au Japon.
Est-ce qu'il y a un moyen, ne serait-ce qu'une possibilité, de les ramener, de les rapatrier? Si oui, comment? Et est-ce que vous avez des nouvelles de l'état de santé des 2 Canadiens qui ont contracté le coronavirus?
Alors, merci pour votre question. Vous avez raison. On a 2 Canadiens qui étaient sur un paquebot qui sont présentement au Japon, qui ont testé positif pour le virus du coronavirus. Nous les accompagnons évidemment avec des services consulaires. Ils ont été pris en charge par les autorités sanitaires locales. Pour ce qui est des 255 Canadiens qui sont aussi à bord, nous leur offrons des services consulaires, mais comme vous savez, les autorités locales japonaises ont décidé de mettre le navire en quarantaine pendant 14 jours. Donc, on est en contact avec les familles, évidemment, les gens qui sont sur place, et on accompagne aussi les 2 Canadiens, les 2 citoyens canadiens qui sont présentement transférés dans des établissements hospitaliers au Japon.
Je veux juste vous amener sur un autre sujet parce que ce soir, Justin Trudeau s'envole pour l'Afrique. Il va rencontrer des dirigeants africains, notamment leur parler de notre intention d'avoir un siège au Conseil de sécurité de l'ONU. Est-ce qu'il n'est pas un peu tard pour tenter de faire les yeux doux à l'Afrique? Et est-ce que vous avez, somme toute, assez bon espoir que le Canada parviendra à obtenir ce siège?
Tout à fait. Écoutez, moi, je suis allé, je pense, c'est la 3e fois. Je vais me rendre aussi avec le premier ministre cette fois-là. Je pense que l'Afrique, c'est important. La francophonie, on a parlé de diplomatie culturelle, diplomatie linguistique. Moi, je pense que la voie du Canada, cette voie-là positive, pour avoir été au Mali récemment, pour avoir été au Maroc, pour avoir été en Égypte, cette vision-là d'un Canada moderne, d'un monde moderne basé sur des règles, du multilatéralisme, d'un pays qui est au-delà, je pense, quand on parle des changements climatiques, quand on parle d'une politique féministe étrangère. Je pense que ça inspire. Et maintenant, pour avoir rencontré beaucoup de jeunes, beaucoup de leaders africains, ils cherchent cette inspiration-là transatlantique au sein du Conseil de sécurité des Nations unies.
Julie Van Dusen, CBC.
Alors, I have a question for you, Mr. Champagne, and then one for Ms. Hajdu. So you had mentioned that you really wanted Canadians who were in China to leave on commercial flights. Do you have any idea how many Canadians are there, and if anyone's has anyone left, and what is your main concern?
Well, first of all, we have, like you said, about 15,000 Canadians who are currently registered with Global Affairs Canada. You know, it's a voluntary website where we encourage, obviously, Canadians to register. That's how we could monitor, as you've seen over the last few days, the number of people in Hubei province and in Wuhan. So we know that for now we have about 15,000 Canadians. What we're saying is that I would say it's just common sense. As our travel advisory said, non-essential travel to China, we're saying that those who might currently be in China for non-essential reasons, they should really use commercial airlines to come back to Canada. And I think this is just a prudent approach. I think it's even common sense. If our travel advisory suggests that you should not be in China for non-essential travel, what we're saying, we encourage people, obviously, to look at airlines to come back to Canada with commercial means.
And if I can just add to that, I think part of the challenge is that commercial airlines are assessing the business rationale for continuing the number of flights daily. We've seen some reports from some commercial flights where they are indicating a significant decline and maybe reducing the number of flights depending on how the situation evolves. So obviously, transportation may get more difficult between the 2 countries as the situation evolves. And given that we don't have a line of sight in terms of how long, for example, China will maintain those quarantines in the province of Hubei, things could become even more difficult for Canadians who are wishing to leave.
And for you, Ms. Hajdu, regarding Trenton, will there be enough room for everybody there? And also, when you're in quarantine like this, I think you've talked about counseling. What can people anticipate they might go through when they're, kept isolated like that for 2 weeks?
There will be enough room, yes, for the first flight and the flight from the United States. We will have to assess our capacity for the potential of a second flight, and we're working on those details now, and we'll tell you more about that as it evolves. In terms of why we are having mental health supports on site, I think it's important to remember that people have been through a very stressful time under quarantine in one of the largest cities in the Hubei province. Obviously, and maybe you've seen some of the videos, I mean, the city is completely shut down. People have not been able to come and go freely, even from their own homes. Many people have been alone and away from their families in a very uncertain situation. This is a scary time for them, not knowing whether or not they're going to be able to get back to Canada and their families. They may be leaving their own established course of study, for example, or they may be employed in Hubei. There are a variety of different situations, but what we do know is that it will be very stressful for them. And so providing those emotional supports and that mental health support, I think, is critical to making sure that they readjust to life in Canada.
Oui, bonjour, Monsieur Champagne. J'ai deux petites questions factuelles et une autre question. Avez-vous un nouveau chiffre sur le nombre de personnes qui vous ont demandé de partir? Savez-vous la ventilation par province, à peu près une proportion de d'où ces gens-là viennent? Est-ce que vous le savez déjà? Et puis ma question, c'est, vous dites qu'il y a eu une couple de no-show à l'aéroport ce matin. Savez-vous combien? Et du coup, est-ce que ces gens-là, il y avait d'autres mondes déjà sur place pour prendre leur place ou est-ce que leurs sièges sont vides dans l'avion?
Alors, je vais essayer de répondre à toutes vos questions. Il y a 347 Canadiens, donc 347 Canadiens qui nous ont demandé d'être évacués de la région de Wuhan. Sur ça, on a 211 personnes sur le manifeste, mais on sait qu'il y en a 194 qui nous ont dit qu'ils se présenteraient. Parce que, je l'ai toujours dit, il y a des gens qui, à la toute dernière minute, peuvent changer d'idée pour des raisons familiales ou autres. Alors, on sait qu'on on en avait 211 sur le manifeste initial. Ce matin, on savait qu'il y en avait 194 qui se présenteraient. Mais évidemment, juste avant de rentrer, je vérifiais avec le centre des opérations à Wuhan. Et là, on a à peu près 50 de l'embarquement qui est complété. Donc, évidemment, dans les prochaines heures, on sera en mesure de vous dire exactement combien on a de Canadiens et Canadiennes à bord. Et à ce moment-là, bien, on verra si on est capable d'identifier la ventilation par province, comme vous avez demandé.
Mais est-ce qu'il y avait plus de monde que les 211 à l'aéroport déjà? Et donc, déjà, vous avez 16 sièges de moins, là, si je suis vos calculs. Est-ce qu'il y a 16 autres personnes qui ont pu monter ou les 16 sièges sont vides? Puis juste pour ma follow-up aussi, I don't know if it's better for you, Minister Hajdu, ou pour vous. You mentioned that for the second flight, there might not be room at Trenton. What scenarios are you looking at as to where you could put these people in quarantine if Trenton is full?
Sur votre première question, alors, évidemment, s'il y a des citoyens canadiens et canadiennes qui étaient à l'aéroport ce matin, si on a la capacité de les faire monter à bord, on va le faire évidemment. Notre première priorité, c'est de rapatrier tout le monde et le plus rapidement possible. Maintenant, là-dessus, il faut vraiment que j'attende que l'avion ait décollé pour avoir le manifeste final parce qu'il y a quand même des règles, mais il y a des choses qui se passent au moment de l'embarquement. L'embarquement, ça prend, dans les circonstances actuelles, à ma connaissance, plusieurs heures. Comme je vous dis, dès que j'ai informé les Canadiens et Canadiennes ce matin que notre avion était sur place, les procédures d'embarquement ont commencé. Ça fait déjà quelques heures. Je pourrais vous revenir si ce chiffre-là change et puis on pourra vous indiquer si c'était des gens qui étaient à l'aéroport. Mais pour les gens qui nous regardent, je veux juste être clair, on ne recommande pas aux gens de se rendre à l'aéroport si leur nom n'est pas sur le manifeste. Parce que je pense que ça pourrait créer d'autres complications. Par contre, s'il y a des gens qui étaient physiquement déjà là et qu'on a de la place disponible sur l'appareil canadien ou voire sur l'appareil américain, c'est sûr qu'on va faire tout ce qu'on peut pour les embarquer à bord. Mais effectivement, avec le deuxième appareil canadien, on sera capable de ramener tout le monde. Ce qui est important pour les gens qui nous regardent, c'est que 2 tiers des Canadiens et Canadiennes qui ont demandé d'être rapatriés seront rapatriés à partir de demain au Canada.
So we'll be assessing very carefully the dates and how long the quarantines of this first group lasts and when the second plane will arrive. But we're working closely with the Department of National Defense to look at other options, and I'll come back to you when we have a better sense.
I appreciate that everybody has a lot of questions, Marie, but we got to move on. You've had several. Okay, sorry about that. Annie Bergeron, Olivier, CTV.
Thank you. So this question is both for Minister Hajdu and Dr. Tam. Minister Hajdu, you mentioned in your remarks that Canadians should be aware that some of the symptoms might be extremely mild. I'm wondering if Canada is now advising people that the coronavirus can be spread before individuals are symptomatic. So is that research that we now have and we're now telling Canadians?
So I will turn to Dr. Tam to talk about the most research on the virus.
So there's no clear evidence that asymptomatic persons transmit. And we have heard some case reports, and that some of them, in fact, have been proven to be people who are mildly sick rather than completely asymptomatic. But let me just stress that even if asymptomatic persons can potentially transmit, this we believe would be very rare based on what we know about coronaviruses. And also that then that's not the main driver of any spread or epidemic. What we're talking about, though, are people, who may just start off being sick. Their symptoms might be more vague. And in those early days, if we're advising people to self-isolate, it's so that in those early days of beginning to develop symptoms, that they are in a place where those can be spotted, but they can then safely present to a health provider, having already put a distance between themselves and others.
Okay, so my second question, I believe, will be for Minister Champagne. It's about the two Canadians. I'm wondering if you can tell us any of the conditions that those two individuals are in, if they're being hospitalized currently, and also if you can provide any update on how many Canadians are on that American charter or who are on the manifest for it.
So first about the cruise ship in Japan, the information that I received, the latest information that I've received is that the two Canadians who have tested positive for the coronavirus had been transferred to local health facility in Japan, that our consular officer were following that with these two individuals. That's what I know at this stage. But we will certainly continue to monitor the situation and with every resources of government to assist them as they go through that process. With respect to the U.S. plane, we think that we'll have and I'll provide you a better assessment again when the plane is in the air, and I would think in a couple of hours. Our assessment this morning is that we would have about 50 Canadians on the U.S. flight. So that's why I could say that 2/3 of Canadians will be repatriated if everything goes well by tomorrow, by the 7th of February. So this is our assessment. But as soon as we are wheels up in Wuhan on both the Canadian flight and the U.S. flight, we will obviously verify the manifest and be able to provide you exact numbers.
Bruce Campion-Smith, Toronto Star.
Hi, good afternoon. A question perhaps for Dr. Tam or Ms. Hajdu. There's at least one federal agency has now implemented a protocol where they're asking all visitors to their facilities, whether they've been to China or they've been in contact with anyone who has been to China. And I'm just wondering, is that direction that came from your office? Is it a good practice? Is it useful?
I don't know exactly what we're referring to, but here's our recommendations. So as you know, China, of course, has 99% of all the cases in the world, and Hubei province is definitely the most affected area. So what we're recommending is for those travelers from Hubei to self-isolate from the 14 days after departure in case they begin to develop symptoms and they then will already be distant themselves from others. For the rest of China, our recommendation is that people closely monitor the symptoms, be vigilant, be prepared, so that if they're at all sick, they know the number to call. We give them sort of the provincial health line, and that they should seek help as soon as possible. But of course, any persons from China who are concerned at all about their risk for coronavirus should also access those helplines and seek support from the local public health.
And I think it is, I mean, again, I also don't know the federal agency you're speaking about, but I think in general, it is flu season and it is cold season, and the public health advice is when you're sick to stay home. So it's actually a good recommendation for Canadians during a season where there is an increase in infectious disease around the flu and around other coronaviruses, that if you're ill, you should stay home and prevent the spread of disease.
Question to Minister Champagne. You've recommended that Canadians should leave China, if they're not there for non-essential reasons. Right. Given that so many airlines have already canceled flights, and there actually could be now trouble getting out of China, is there any thought to having to put on further flights to other parts of China to, help Canadians get out, who might not be able to avail of a commercial flight?
Well, thank you for your question. I mean, as you remember, when we first looked at the situation, that was to assess the need and charter the plane. What is specific to Wuhan and Hubei is that the whole region is in quarantine. So obviously we acted quickly to assist Canadians, as we would always do, because within quarantine, and again, I want to put in perspective for Canadians, Wuhan is a city bigger than New York or London in terms of population. So you're talking about a city of about 11 million, which is basically on lockdown, where the latest information I had, you had about 6,000 cabs, which are legally allowed to move around. So we did something there, which is probably one of the most complex operations we did, both on the ground logistics to make sure that people not only provide the plane to the airport, but obviously assisting people with the logistics. We need to provide plate number, vehicle number, driver's name, plus the manifest. So there's a lot of logistics on the ground. What I'm saying, and I think it's based on best advice in our travel advisory, is that, as Minister Hajdu has said, this is a very fast-evolving situation in China. And what I'm saying is that since there are currently still commercial flights between China mainland and Hong Kong and Canada, those Canadians who are in those areas should really seek to come back, if they're there for non-essential reasons, to commercial flights. We are aware there's a number of Chinese companies which are flying to Canada. There's a number of flights from Hong Kong. And I think it's just common sense, if the travel advisory suggests that Canadians should use commercial means, while, like Minister Hajdu said, airlines are making decisions, as you've seen, day by day about how many planes and whether they will continue certain routing in particular. So our advice is to say, whilst these planes or this transportation commercially exist, people should take avail of them.
Ray Fillion, TVA.
Deux questions pour vous, M. Champagne. Bonjour. D'abord, concernant l'avion, est-ce qu'il y a des citoyens canadiens qui, pour une raison ou pour une autre, ont dû rebrousser chemin ce matin, n'ont pas pu avoir accès au vol? L'autre question est par rapport aux navires de croisière. Il y a des gens qui se disent très inquiets, des gens qui doivent prendre des médicaments, commencent à manquer de médicaments, des personnes diabétiques, entre autres. Qu'est-ce que vous pouvez faire pour ces gens ou qu'est-ce que vous leur conseillez de faire?
Donc, merci pour votre question. Je n'ai pas l'information s'il y a des gens qui ont dû rebrousser chemin parce que vraiment l'opération est en cours à ce moment-là. Ça sera au moment que le manifeste final, comme je vous disais, quand je suis arrivé ici, je parlais avec le centre des opérations à Wuhan juste avant de rentrer dans la pièce. On avait 50% de l'embarquement qui était complété. Donc là, on doit être rendu à 60% ou un petit peu plus. Donc, je ne peux pas vous dire exactement s'il y a des gens qui voulaient, qui n'ont pas pu embarquer à bord. Évidemment, on a deux options. On a l'avion canadien et on a l'avion américain. Donc, je vais vous revenir avec les nombres exacts. Pour ce qui est, évidemment, des Canadiens qui sont, j'imagine, vous faites référence au paquebot au Japon. On est en contact, évidemment, avec les autorités. On a obtenu le manifeste des gens à bord de ce navire-là. On est en contact avec la compagnie qui est propriétaire de ce navire-là pour voir si l'ensemble des Canadiens et Canadiennes à bord ont toute l'assistance médicale dont ils pourraient avoir besoin. Et on travaille aussi avec les autorités japonaises pour des cas comme ceux que vous avez mentionnés, par exemple au niveau des médicaments, pour voir ce qui est possible. Évidemment, on est là pour appuyer les Canadiens et Canadiennes, évidemment, qui ont besoin d'assistance, mais on doit travailler avec les autorités sanitaires japonaises pour voir ce qui est possible. Comme vous savez, le navire est en quarantaine, donc il y a des discussions présentement pour voir comment on pourrait leur fournir l'assistance s'ils en ont besoin.
Pour revenir sur la candidature du Canada pour un siège au Conseil de sécurité des Nations unies, est-ce que le Canada accuse du retard par rapport aux autres pays concurrents que sont l'Irlande et la Norvège?
Bien, moi, je pense que c'est cette vision-là du monde que le Canada projette qui intéresse les pays. Et nous, on va continuer de le faire. Évidemment, le premier ministre, moi aussi, on sera en Afrique cette semaine, on sera en Europe aussi, mais on va continuer de faire valoir un siège au Conseil de sécurité, c'est de permettre aussi à plusieurs pays d'avoir cette voix-là, d'avoir une voix positive sur les changements climatiques, sur, par exemple, dans notre cas, la francophonie. Moi, je vous dirais que quand on regarde les réactions des pays présentement, je pense que les gens voient la candidature du Canada avec un bon œil parce que c'est cette vision-là transatlantique que les gens voudraient voir. Un pays francophone, un pays membre du Commonwealth, de la francophonie, du G7, du G20, de l'OTAN qui serait là pour amener cette voie-là. Je peux vous dire, après avoir rencontré des dirigeants africains, ils souhaitent cette vision-là présente du Canada au sein du Conseil de sécurité.
Laura Osman, Canadian Press.
Minister Champagne, I'm just wondering, what is the reason for the several days delay before the second chartered flight, and what activity is going to be happening at the government level in terms of preparation in the meantime?
Well, I'm happy you asked the question because actually it's pretty good that the second plane will be leaving, departing Wuhan on the 10th of February and arriving in Trenton on the 11th. Because as you will recall, we need to provide the manifest to the Chinese authorities within 24 hours. So we really want to make sure that at the end, because that would be the third plane, as I called it, or the second Canadian plane, that all of those who may not have been able to go to the airport for whatever reason, whether they're personal, whether because traffic or other logistics, that we give them enough time to say this is the second Canadian plane, so you have ample time to make sure you do all the preparation to get there. So I think it's a good thing because then people will we will make sure that everyone who wants to depart will have, let's say, a third chance to come back to Canada. And your question was about the...
What activity is the government going to be undertaking in preparation?
Well, we have two, what we call standing rapid deployment team in Wuhan to help the people. We'll continue to provide them. And let's remember, there'll be Canadians left in Wuhan that have decided to stay. So we will continue to provide the services to those Canadians who are there because you've seen the number fluctuating over the week. Some people have just decided to stay. We had some this morning who were supposed to come back with us and just made a decision to stay. So we will make sure that we continue to provide consular assistance to these Canadians in Hubei and in Wuhan in particular.
And to the health minister, what is a day at the CFB Trenton going to look like for these evacuees? Are they going to be largely kept in their rooms? Will they be allowed to move around? Like, what is their day going to look like?
Well, the purpose of isolation is actually to prevent interaction between individuals. Family units will be housed together and will be able to stay together. Meals will be delivered to people in their rooms. And that's why we'll have a lot of support staff there, both from a mental health perspective, but also to ensure that needs are getting met, whatever those needs might be. So, you know, this is part of the stress of being in a quarantine situation is you know, individuals will have to find ways to occupy themselves with very little movement on the base.
Tom Perry, CBC.
CBC Radio, that is. Right
there. Question for Minister Champagne. We've heard from you that the Chinese were going to be pretty much limiting exclusively the manifest on this plane to Canadian citizens, and yet we're hearing stories about permanent residents getting on these flights. So what happened?
Well, I'll give you an example. So the number I had in the manifest this morning, not the final manifest, but the one at least that was provided before we do the final boarding. I'll give you a sense of perspective. We had 34 minors, which were on the manifest. Of that, we had 13 permanent residents, which I suspect were primary caregivers because China has not moved except for family unity. And we had 6 Chinese visa holders that were allowed to be on the manifest. So when I have the final manifest, I'll be able to answer that question. Obviously, like I said, we are aware of the rules that China has been putting forward for all nations, but clearly we're going to be trying our best, and if we have a chance, because a lot of that, as you would appreciate, is done pretty much at the gate at the very end, who gets in or not. So we're certainly pushing to include also permanent residents who could be coming back home, and we will continue to make that representation to China.
On the Hong Kong cruise ship, we've been hearing from some Canadians that they feel like prisoners. They're stuck in their cabins. What do you think about the conditions they're in? Can you help them? And is there going to be any help for them to return to Canada once this ordeal is over?
So for Canadians who are watching us, so we have a cruise ship in Japan, but we also have Canadians on a cruise ship in Hong Kong. In Hong Kong, we have about 30 Canadians that I'm aware of on that cruise ship. The latest information I had as I walked in is that they were going now to a screening. So I personally don't yet know if anyone has been diagnosed with the virus or not. And I suspect this is going to determine the next course of action. Certainly, we're watching that. As I'm talking to you, my understanding is that they're screening passengers. And once this screening is completed, obviously we'll have a better picture as to what kind of assistance we can provide and what are the local health authorities want to do with that particular ship and obviously the passengers.
This goes next question.
Canadians.
Well, always. I mean, you know, we have a full team. We have our operations center here in Ottawa, which is fully staffed. We have a call center in Beijing with 30 people. We have 2 standing rapid deployment team, 1 in Wuhan. I mean, everyone is looking at that, both in Tokyo and obviously in Beijing, to assist everyone, including obviously those in Hong Kong.
Crystal, Global News. Crystal, what's your last name? Oh, Global News over here.
My questions are for Minister Champagne. Earlier you said that some of the Canadians who didn't make the flight might be because they changed their mind, but there was also other reasons. Could you maybe tell us what those other reasons are and maybe some more final numbers on who didn't make that flight?
Well, you know, I can only suspect because obviously if they had indicated to us we had 211 people on the manifest, the latest information I had was that 194 of these 211 had then, you know, told us this morning that they wanted to board. It may be as simple as someone changing their mind, and certainly we respect, obviously, the wish of Canadians. So that's the situation. And yes, we will give you exact numbers. You know, by the time this press conference is over, maybe the planes will have departed, and at that time I'll get the manifest, and we will make sure that we were transparent with the Canadian public, so you will know exactly how many Canadians are on the Canadian flight, how many Canadians are on the U.S. flight, and all these people are coming back tomorrow.
And now on the cruise ships, is there a plan for when these Canadians come back from the cruise ships? Are they going to be under quarantine, similar to Trenton, or what is the situation for when they come back?
It depends on the situation that the Canadian is in. If they've been quarantined for 14 days on a cruise ship, then they've already been quarantined for the recommended time that we know that symptoms will show themselves. So I'll turn to Dr. Tam for a bit more on that.
Well, I think just as a general sort of factual piece is that they would have been quarantined under the Quarantine Act or the equivalent from the Japanese. You have to respect when a country quarantines you and put the ship in quarantine. The Japanese authorities are the ones ultimately deciding on these next steps, and absolutely, if they've already been on the ship for 14 days and were well, then we don't expect that these individuals will then be of a risk to the general population.
Melanie Marquis, La Presse, right here in the middle.
Monsieur Champagne, pour poursuivre sur les 255 Canadiens qui sont sur le bateau de croisière, est-ce qu'il y a eu des demandes de repatriement et puis quelle est la marge de manœuvre, quelle serait la marge de manœuvre du Canada pour les rapatrier? Ça prendrait une permission des autorités japonaises?
Alors, leurs conditions, je sais qu'on est en contact avec eux. Évidemment, je suis comme vous les dernières nouvelles. À ma connaissance, on leur fournit l'assistance, mais comme le Dr Tan le disait, évidemment, c'est les autorités japonaises, dans le cas du navire, évidemment, qui est au Japon, qui dictent un peu la conduite sanitaire en ce qui concerne ces gens-là. Comme le Dr Tan le disait plus tôt, évidemment, si les autorités sanitaires japonaises ont, comme ils l'ont fait, imposé une quarantaine aux navires et aux passagers, bien évidemment, on se doit de respecter cette décision-là des autorités japonaises. Évidemment, on est en contact parce qu'en vertu de la Convention de Vienne, on a le droit d'avoir des contacts consulaires avec ces gens-là pour leur fournir l'assistance nécessaire, mais certainement, dans un cas d'urgence de santé publique, bon, on doit s'en remettre aux autorités locales, mais c'est sûr qu'on est en contact avec eux. Comme votre collègue disait, par exemple, au niveau des médicaments, on veut s'assurer que tous ceux qui auraient besoin de médicaments ont accès à leurs médicaments. Mais évidemment, comme vous comprenez, il faut travailler dans ce cas-là avec les autorités sanitaires locales. Il faut travailler évidemment avec le propriétaire du navire. Et on joue ce rôle-là consulaire d'essayer de coordonner entre tout ce monde-là pour que les Canadiens et les Canadiennes à bord aient tous les services dont ils ont besoin.
Sur un autre sujet maintenant, l'Iran. Vous avez parlé récemment à votre homologue iranien. Que vous a-t-il dit au sujet des boîtes noires? Pourquoi est-ce que ça tarde de temps? Pourquoi est-ce que ça brande dans le manche?
Bien, je lui ai parlé hier. On a eu une discussion d'environ 45 minutes. C'était la deuxième. On s'est parlé une fois, on a eu une rencontre en personne. C'était la troisième fois qu'on se parlait. Bien, je lui ai fait part de l'inquiétude du Canada, des familles, parce que nous, d'abord, depuis le début, ça a été de se tenir debout pour les familles qui veulent la justice, qui veulent de la transparence, qui veulent avoir des réponses. Alors, moi, je lui disais qu'effectivement, on arrive près du 30 jours depuis l'écrasement de l'avion. La Convention, elle est claire. L'annexe 13 parle de lire le contenu des boîtes noires sans délai. Alors, c'est pour ça que le ministre Garneau et moi, on est allés rencontrer le président de l'OACI et la directrice générale la semaine dernière, justement pour faire pression sur l'Organisation de l'aviation civile internationale pour nous aider, évidemment, à dire à l'Iran, il vient un temps où lorsqu'on essaie de trouver les mécanismes pour lire les boîtes noires, on ne les a pas. Ce qu'on a dit, c'est que la communauté internationale, le groupe de coordination internationale, on dit maintenant, ces boîtes-là doivent être envoyées à Paris, parce qu'il devient clair qu'après plus de 30 jours où l'Iran n'a pas été capable, pour des raisons techniques ou autres, de lire ces boîtes noires-là, que les boîtes noires doivent être envoyées à Paris pour qu'on puisse les analyser et le faire aussi devant la communauté internationale, parce que aujourd'hui, c'est le monde qui regarde l'Iran. Et moi, j'ai toujours dit, je juge l'Iran non pas par leurs mots, mais par leurs actions, et je juge jour par jour. Clairement, sur la partie consulaire, on a obtenu, pour le rapatriement des corps, on a eu une coopération, mais là, clairement, il y a un blocage au niveau des boîtes noires. Et ce que j'ai dit au ministre des Affaires étrangères, c'était que l'Iran se doit de prendre une décision rapidement pour qu'on puisse faire la lumière sur le contenu des boîtes noires.
Our time is running short now, so I'm going to take one more question from the room, Michelle Zilio from the Globe and Mail. Then we'll go to the phone because we have some people listening on the phone across the country. So, Michelle.
So I think it was about a week ago officials were not telling people to self-isolate after returning from Hubei, but now this policy has changed. So can you explain some of the thinking behind that policy change, please?
Yes. We are constantly sort of revisited, together with all the provincial territorial chief medical officers of health, the evolving situation. I think given the world, this is quite a special period of containment from what the Chinese authorities are doing. We felt that we need to enhance this global effort. This is actually quite an important period. And then in the next days, we hope to see if there's any signs that some of these measures may be beginning to take effect. During this period of time, out of precaution and total amount of prudence, if you like, we feel that this is the right message. We also actually know that many people who came from China, or from Hubei province, have already been self-isolating in the community. And so I just want to stress that I'm really concerned about racism and stigmatization. And we're looking for people to self-isolate, to contribute to the global containment effort to interrupt the line of spread, if you like. So, and we mustn't forget that anyone who came back from those regions could be potentially exposed, not just people of a certain race. So this applies to all travelers, and that we need to support people in this really very sensitive period in the global containment efforts. And so that's a very key reason why. Of course, we're always taking several steps forwards to plan ahead, should we ever need to enhance those advice or border measures, and we'll keep Canadians informed as we do those.
We'll go to the phone then. Operator, can you tell us if there's anyone on the phone for a question?
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur l'étoile maintenant pour poser une question. There will be a brief pause while the participants register. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. We have a question from Richard Warnikoff from the National Post. Please go ahead. Votre ligne est ouverte.
Can you speak up, please? We can't hear you in the room.
Oh, sorry. Can you tell me, are there other residents staying in the Yukon Mall?
Thank you for the question. No, although some staff may be staying on site because it is a 24-hour operation, but there are not other residents staying in that area.
And just as a follow-up, you mentioned the staff and people delivering food. Who are the staff and where are they coming from? Who will be interacting with the people in quarantine?
It's a provincial-federal partnership, and there are a variety of staff from a variety of different organizations, including from Red Cross Canada.
Next question.
Thank you. Merci. The next question, Andrea Gunn from the Chronicle Herald. Please go ahead. Your line is open. Votre ligne est ouverte.
Will you be releasing where the people who are currently en route to Canada from Wuhan are from? Like if they're, from different provinces for regional reporters who want more localized information?
Well, the answer to that, I would say, first we need to have the final manifest, and then we need to be clear about the privacy laws that would apply. So we will, we might be in a position to provide aggregate numbers, but we will certainly come back to you at a later stage with that. First, we need to have the final numbers on the manifest.
And I think.
Well, our operation has been based on the quarantine area, which is in Wuhan, and you've seen that evolving in our operation. For the rest, we'll continue to provide consular services to those who stay in Wuhan and even in Hubei province and obviously across China. But I would say, based on the travel advisory that we've put out to avoid non-essential travel, that's why Dr. Tan, myself, and Minister Hajdu, we've said that Canadians who are there for non-essential reasons should really look at commercial options to come back to Canada, and that would be the best advice I could give them at this stage.
Okay, operator, thank you. We're going to conclude the questions from the phone and just end the news conference with one question from the room from Lucy Zhou, New Tang Dynasty.
Minister Champagne, since Wuhan is not the only city that has been locked down, there are 15 others in Hubei city, and there's right now like a city like Wenzhou, which is 900 kilometers away from Wuhan, being locked down. So are the people who asking help and to come back all from Wuhan, or are there people from other lockdown cities?
Well, the information that I have is that Wuhan has been, I would call it, on complete lockdown, in a sense that that the airport is closed and there's no commercial way for people to come back or to be repatriated to Canada. That's why we have mounted, like other countries, an operation to basically airlift these people, because we understand that if you live there, you cannot come back on commercial means because the city is in lockdown. So that's why we said in our travel advisory, if it's non-essential, you should really look at options to come back on commercial flights, because my understanding is that in other regions of China, there are ways for you to get to an airport which will allow you to come back on commercial means, and certainly that's in line with our travel advisory.
But those cities are already locked down, like Wuhan. They cannot get out, right?
Well, the information I have, I would say, is that the city which is in complete lockdown is Wuhan, where you cannot today leave your residence and go to the airport, basically, or in Hubei province. That's why we have staged our operation there. And I would say our response is pretty consistent with the international community, which we've said why we are doing that in particular is because we understood that these people, those Canadians which are there, would be stranded if we were not sending flights. And this is similar with what other countries have decided to do. That's why I think it is just common sense, based on the travel advisory, that Canadians who can and are in China for non-essential reasons should seek to depart through commercial means.
That's all the time we have today. Thanks very much, ministers. Dr. Tam. Thank you.
Thank you.
Who's going to handle it?